So, Dr. Boz, I know that this whole keto, the use of keto to restore health, this is a kind of a personal crusade for you, something you're very passionate about. And I want to just start with a wide question. Where do you see diet in itself fitting into our cellular health and the chronic array of chronic diseases from dementia to diabetes, cancer that we're seeing on the rise in many cases?
Well, first of all, thank you for inviting me, Brendan. I'm excited to be on your show, and I hope the questions challenge me because I love almost wowing people with the answer to the question you just asked me, which is how big of an impact does this food thing have? And I contend that if everybody did this metabolic pulsing, this metabolic workout of their cells, you would put us out of a job. Meaning, I love seeing patients get healthy. It is, maybe something that the cynical world of medical care doesn't show people, but there are folks who really do want to reverse medical problems. And I didn't think that was possible. I thought for sure, you take my prescriptions. This is how I was trained. Here's how the world works today. And the overwhelming number of problems that come in the front door of an internal medicine clinic can not just be improved, but reversed by the way people eat. It still fascinates me. I've been doing this for 10 years now, and I'm not going anywhere. I won't go anywhere until I understand everything, and I'm not even close.
What would you say? What would you put forth as the main sign, or one of the compelling signs that is the case, that what we're eating is impacting our health that much?
Yeah, I think the best way to answer that is to take a patient who's had high blood pressure, comes in to get their prescriptions refilled, middle-aged, take 30 to 60 years old, typical patient, and blood pressure is just such a common issue that would come through the front door that you think, oh, that's not going to make any difference by the way you eat. Maybe a little lower salt is what I used to tell patients. But in these last 10 years, as I offer, do you want to get off these prescription medications? And that would have been a false claim in my mind 10 years ago. That there's no way, once the blood pressure starts getting high, even if they lose the weight, they still ended up with a chronic condition of high blood pressure. And I've had patients as high as 5 prescription medications to control the blood pressure, and within a week, their blood pressure was normal. That's crazy. I couldn't get there with the highest technology, the best medicine in the world, couldn't lower their blood pressure, but changing the way they eat did that. I mean, those were some of the first aha moments where I knew this was much bigger than just, well, the story that I was living out, which was I wanted to heal brains faster. And it turns out the chemistry that floats throughout your body at the time of the brain injury and then after the brain injury is really important on healing that brain. So as I'm tinkering with chronic brain injuries, of course, I have patients with other medical problems. And as they implemented a change in their diet, and I'm not saying a little bit, I'm a pretty strict advocate for measuring an outcome that you can get real change from. And I think I'm honest when I say in 10 years, I haven't met a patient who didn't get better, maybe not all the way better, but better by implementing a strict change in the way they eat, with the reduction of processed foods, the reduction of carbohydrates, and increase their fat, and watch what happens to their health. Those indications it is so widespread in the examples that I've taken care of for the last decade that I'm having trouble right now thinking of an exception.
Is what you just described basically a keto diet in a nutshell, would you say?
Yeah, I really am an advocate that you should measure something if you're going to try and see if it works. And although diets come in many flavors and you have lots of folks advocating for different ones, what attracted me to the ketogenic diet was you can measure it's not just the consumption of food, it is the consumption of food to result in a chemistry set that reduces their risk of cancer, reduces their blood pressure, decreases their weight, improves their brain. I mean, the list was so profound that I'm like, I felt like a snake oil salesman. Like, how can it fix all of those things? But indeed, I've been shocked by some of the things my patients brought to me, 6 months into following the process of a persistent state of ketosis. And they said, Doc, that tinnitus, that ear ringing that you've been trying to help me with for a decade, it is gone. And at first I'm like, I don't believe you. And then patient after patient were like, wow. And, those are the kinds of moments where, if you ever needed humility as a physician, you think, okay, I understand this. I know what I'm doing. I'm telling the patient the right thing. And then they prove you wrong. And it's been the funnest journey for me, looking at how a ketogenic state. So again, when people come in and say, well, if I just lower my carbohydrates, am I okay? And let's take somebody with your health, not overweight, pays attention to many of the health factors, that it would be a pretty restrictive diet in someone who's already rather healthy. But unfortunately, most of the patients that came into my clinic and still come to my clinic, well, they're the average American. They are overweight. They have high blood pressure. Their cholesterol's off the roof. And when I tell them to eat high fat, they kind of look at me like, did you misspeak? Because it is counterintuitive.
There's a culturally instilled fear of fat. I've noticed in our society, in our culture. It's not so much in other cultures. I've noticed in Chinese culture, it's not so much the case. They don't have this inbuilt fear of fat. But this is something we'll get into. I'm looking forward to getting into with you, Dr. Boz, what a keto diet should look like, especially in your terms, and how this can be measured, how someone is being effective in introducing a keto diet. To start with, I'd like to go into the anti-aging field, and if you don't mind me saying, I was a little surprised to find out your age as I've been looking at some of your work. I won't reveal it here unless you want to.
I tell everybody it's okay. I'm happy God gave me another year. Yeah, I turn 53 next month. I've been saying 53 for about 6 months, which is a terrible habit that I think all my patients do. Is, once you get past a certain age, you just start rounding up halfway through the year. I honestly turned 53 at the end of the month, and I think, I've been on YouTube for a decade. At first, it was this place where I needed to educate patients, and I didn't have the time. So I wasn't on the ketogenic diet on those first few videos. And now I'm 10 years later, and I'm shocked by how I looked then versus how I look now. I mean, I teach patients that when you're helping your body be as healthy as possible, and oh gosh, there are these tag words that are abused. They have just been overused, but I'm going to use them and try to put them in context. And some of those words are that we want to reduce inflammation. So chronic inflammation is the core, footprint for anybody who's trying to look old, to age faster. If you want rapid trip from now to your grave, that chronic inflammation is the answer. And I giggle because, oh my gosh, when patients bring me antioxidants that say we reduce inflammation, and I'm like, maybe in your left toenail, but that is not enough power to reduce inflammation in your body. When we look at the markers for aging, they are all linked to this inside the cell inflammatory problem that you're going to have if you're alive. You're going to make inflammation as a signal to some warning signs to the rest of the body. And then if your body's metabolism is, it's running on a poor fuel, a fuel with lots of waste, those cells end up with trash inside. Nobody tells you. It's not part of what you hear. You don't even get to measure it in many ways until it's been happening year after year after year. And then these tiny little things start to show up on lab tests. Their inflammatory markers are higher. Their risk of aging is more because of those. And you can see it. they have to have that chronic inflammation for at least 4 to 5 years before I start to be able to put a diagnosis on their, oh, they have a skin rash that doesn't go away, or, oh, they have, a brain that just doesn't want to focus. It got, depressed, and they couldn't come out of it like they did before. Or more serious problems. They have high blood pressure. They have a kidney that's not healing well. And all of these are tiny little ticks inside a chart that they accumulate. And when that patient starts to age and they get enough of them, then coming back from that, well, I used to think it was impossible, but I don't think that anymore. And if you look at those videos from 10 years ago, man, well, I looked 53 then. And I agree with you. I do several things to improve what we talk about as autophagy, or that process that our body is designed to do to clean up the trash around the house, or clean up the trash around the cells. But you cannot do that in most diets today. In most places, that blood sugar is just a little too high. The amount of insulin that came along with that blood sugar is significantly higher than it should be. And autophagy is only going to happen when that body is able to lower the blood sugar, lower the insulin, and find ketones in circulation.